Thank you very much, and thank you for inviting me to be part of this virtual seminar. I'm really quite excited. I was really looking forward to the meeting in the Philippines that was planned for this year, but as we know, these things haven't quite gone according to plan, so I'm looking forward to the next one. So for those of you who don't know me, obviously my name's Anna Davey. I've been involved in forensic science since 1988. So I started as a bench work scientist and moved, through the management systems, ended up at the National Institute of Forensic Science, and then in 2008 formed Forensic Foundations. I've got quite a bit of experience with proficiency tests, both as a bench scientist, not really knowing quite why I was doing them, through to involvement in my management role, involvement as the quality manager, and now Forensic Foundations is an accredited proficiency test provider, so we're actually providing proficiency tests. I've got quite a passion for forensic science and for forensic proficiency tests, as you'll probably gather during this presentation. I just want to say, if you hear some tweeting in the background, that's because I'm actually working from my home office, and I have an aviary next to my office, which is lovely to look out on, but can sometimes be a little bit disruptive when I'm doing presentations. The other thing I'd like to say is that a number of my slides have quite a lot of information on them. I don't intend to read the information on them, and I don't expect you to read the information on them. I'm just highlighting a few things, but using lots of words in the process. These slides are available either through Sylvia or alternatively, you can contact Forensic Foundations and I'll send you a copy of the slides. So please don't be daunted if you see lots of words on the screen. So talking about the screen, I'll just attempt to share my screen. So hopefully you can see my screen. Can somebody
Yes,
just
yeah, I can
let me
see it
know
perfectly well.
that you can see my screen? That's great. Okay.
Yeah,
So, yes, so this presentation is actually made on behalf of myself and other members of Forensic Foundations. So, as I said, lots and lots of slides, lots and lots of words on the slides. What I'd like to talk about, just to start with, is some of the requirements within the standards and some of the supplementary documents in relation to proficiency testing. I would be really interested to have a chat with my Chinese colleagues at another time to talk to look at what they've got in their standards with regards to proficiency testing. On this slide, I've mentioned the requirements in ISO 17025, also the supplementary requirements from NAAB, and also the supplementary requirements from NATA. Now, I realise there are other documents, there are other supplementary requirements. There are some from ILAC and there's some from A2LA and also from UCAS. So this is just a snapshot, and obviously there's a lot more information out there, but I've only got half an hour. I can talk all day on this, but just for today, we'll just deal with these ones. So basically, 17025 says that a laboratory must, note the word must, monitor its performance by comparison with results from other laboratories. And that can be by means of proficiency testing or interlab collaborative studies. NAAB also has a requirement, as does NATA. As I said, I'm not going to read all the words. You can see that there's quite a bit there. What I would like to do is just focus on a few of those words. So 17025 isn't specific about how frequently people should participate in proficiency tests or interlab comparisons, but NAAB does have a requirement of at least one proficiency test per discipline, and NATA also has requirements at least once every 2 years in each major area of testing or measurement, and at least once per skill set. So there are requirements in the supplementary documents with relation to the frequency of proficiency testing. The second thing I'd like to highlight in these requirements is the fact that proficiency testing is looking at the proficiency of the laboratory or the facility. Okay, so I've highlighted here the words the laboratory, its performance, comparing those results with other laboratories. Talks about NAAB talks about other forensic science service providers. NATA talks about facilities. So when we're looking at proficiency tests, we're looking at the overall performance of a laboratory. We're not necessarily looking at the performance of an individual, and I'll talk about that a little bit more further into this presentation. Now, NATA also has a requirement, it's not a requirement, it's a note, but it's a recommendation, that proficiency tests should be handled in the same way as routine casework as far as practicable. So a test ideally should represent the type of exhibits, the type of items, the type of samples that the laboratory would be analysing in their normal routine casework. Now, we notice that that's as far as practical, and we realise that it's not always possible to do that. Okay, but that means that proficiency tests should be treated identically or as close as possible to how you would treat those items if they came in as a real case. I'll talk a little bit more about that as we go through. Okay, there's another section, and that has to do with the monitoring of proficiency tests. Okay, so there's nothing in NAAB about under 7.7.3 that is in the NATA supplementary requirements. And again, it talks about laboratory activities and facility performance. We're talking about the organisation as a whole when we're looking at monitoring the activities. Now, NAAB also has a number of additional requirements. This particular one, there's a number of them. I've only highlighted one here. But this one actually does mention the performance of personnel as part of the monitoring of the proficiency tests. Now, that's part of the monitoring and part of the proficiency test. It's not the whole proficiency test, but it does actually mention the performance of personnel. However, proficiency tests and interlab collaborative comparisons are so much more than ticking the box. If we go back to the beginning of these slides, I hope I'm not making you all seasick. It says here the laboratory must monitor its performance by comparison with the results of other laboratories. We could do that. We could just tick the box and actually do it. It would meet our accreditation requirements. But there's so much more we can get out of proficiency tests if we look at them in detail. Proficiency tests and interlab collaborative trials and intra-laboratory collaborative trials offer so much more than just meeting the standard requirements or accreditation requirements. Proficiency tests and interlab collaborative trials are like the Swiss Army knife of forensic science laboratories. We can get so much out of one test. The proficiency tests are not a tool, not an end in themselves. Now, before we go much further, I just want to make sure that we're all on the same page, because as I said, I started as a bench scientist, slowly worked my way up through management, and I must admit that until I delved into proficiency tests to a deeper degree, I wasn't sure what the difference was between various types of tests. So just before I continue with this presentation, I'd just like to discuss a little bit about what I mean when I use particular terms. Okay, so the things we're going to look at is what's a proficiency test? How is that different from a competency test? What's an interlaboratory collaborative trial? What's an intra-laboratory collaborative trial? And what's the difference between a declared test and a blind test? So here is the definition for proficiency testing out of ISO 17043. This is the ISO standard for providers of proficiency tests. So I've taken that out of that particular standard. Okay, so it's an evaluation of participant performance against pre-established criteria by means of interlaboratory comparisons. Another way of saying pre-established criteria is ground truth. We know what the expected answer is before we actually do the test. Right. Under note 1, you'll notice that there's quite a wide range of different types of proficiency testing. The ones that we are more traditionally used to would be the simultaneous proficiency tests, the ones where a proficiency test item is manufactured, or a number of items are manufactured identically, they're sent out to different labs at the same time, there's a return date, the results are sent back to a central body who then assess the results and issue a final report. We're also used to continuous proficiency tests where, for instance, a biology test or a drug analysis test is offered a number of times a year. But there's all sorts of different types of tests that we can actually look at. One of the things that I'm quite interested in terms of the end-to-end forensic process is sampling. If an item comes into the laboratory and is examined and sampled, and those samples are subsequently analysed, those results interpreted, that's all well and good. But if during that initial examination period items of interest or samples of interest are not recognised and collected for subsequent analysis, well then you've lost that information. And that's what I'm talking about when I mention end-to-end forensic processes or end-to-end proficiency testing. We're actually treating the proficiency tests as we would a case that would come in to the forensic laboratory. The test would initially be received, issues to do with continuity would be checked, the items would be recorded, they would be examined, they would be sampled, there would be some analysis, there'd be some interpretation, there'd be reporting, and all of those steps need to be recognised and replicated where possible in proficiency tests, so that if we're looking at proficiency tests to give us some sort of indication of how we're performing with our casework, we're actually comparing apples with apples. If we receive samples which are not representative of the sort of items that we're examining as in real casework, then what we're doing is we're comparing apples with oranges, and there really is no comparison. So we need to ensure that when we're doing proficiency tests, they actually represent the sort of work that we're actually undertaking. So that's proficiency testing. Competency testing is a different kettle of fish altogether. Competency testing is testing an individual's competency. I highlighted previously that proficiency tests assess a facility, the facility's results. And the reason for that is that those results may be the product of a number of people's work, particularly if you work in a laboratory that utilises the team approach. Also, those results will be technically reviewed and they will be administratively reviewed. So what we're looking at is the final result, the final product of the laboratory. We're not looking at the final product of any one individual. So competency testing is different. Competency testing is looking at an individual's competency. And competency is defined as the ability to do something successfully or efficiently. And so it's not that a team, it's not a test of a team or a laboratory or facility. Now, having said that, competency can be reviewed as part of the review of a proficiency test, because you can identify who did what parts of the test. So yes, competency can be reviewed as part of the PT review, but a competency test is something quite different from a proficiency test. Under 17043, the definition of interlaboratory comparisons, or I tend to call them interlaboratory comparative trials, is an evaluation of participant performance against pre-established criteria by the means of interlaboratory comparisons. We don't necessarily need to know what the ground truth is. There doesn't need to be pre-established criteria. What we're looking at is sending the same material or the same actual material, in case of a round robin test, to a number of laboratories and then reviewing their results. Okay. So it has some similarities with proficiency testing, but it actually serves a completely different purpose. The other thing you can also do is set up intra-laboratory collaborative trials. Obviously intra-laboratory within the laboratory, and here you might set up the same test or similar test and ask a number of individuals or a number of teams to actually undertake that work, and then you can compare the results. The next distinction I'd like to make is between declared tests or trials and blind tests or trials, and this has to do with transparency. With a declared test, the laboratory and the practitioners know that this is a proficiency test or a collaborative trial. With a blind test, the test is blinded. The participants do not know that it is a test or a trial. So they would receive what they think is a real case, and they would analyse it, treat it in exactly the same way that they would treat a routine case. Now, there will be people in the laboratory that know that it's a test or a trial of some sort, because they will need to work with the people who submit the exhibits and ensure that when reports go out, they actually are intercepted before they get into the justice system, because they're tests, not real casework. All right. But the participants, the people who are actually working on the test, don't actually know that it's a test. There are a number of advantages and disadvantages of doing blind and declared proficiency tests. And there is an increasing amount of literature, scientific literature, looking at particularly the implementation of blind proficiency tests. This is a recent article that's publicly available. This is an open source journal, so you can easily access it, right? And it's got this very interesting diagram in it, where it's looking at not just proficiency tests, but other types of quality management tools. and it's looking at R&D and training and education, moving towards better methods and increasing amounts of quality assurance and training. And it's looking at the impact of these things on errors, accuracy, mistakes or malpractice, and deliberate misconduct. Now, just thinking about blind and declared proficiency tests, if you know that a test is a proficiency test, what does that mean to you as an operational forensic scientist? How are you going to treat that item? You might treat it differently than you might do casework. Hopefully you wouldn't, but unfortunately the reality is that people do. They do know that this is a test. The advantages of declared proficiency tests are they're relatively easy to set up. But as I've indicated, the participants know it's a test, and so error rates are not representative of casework. Blind proficiency tests are more realistic representation of actual laboratory performance and can provide a more accurate estimation of error. And those people who work in the framework of the Doorberg criteria would know that an estimation of the error rate is one of the things that the courts wants to know about the particular scientific technique that's being used or being presented in court. However, they can be very complex to set up, because what you need is you need to have the input of the submitting agency. You need to have them representative of these items that would normally be examined in the sort of packaging that those items would normally be presented to the laboratory in. And you've also got to make sure that there is someone in the submitting agency who is able to respond to questions about that case in case the analyst needs to get further clarification. So they're extremely complex to set up, but very worthwhile. As I said, there's an increasing interest in the forensic science community in the use of blind proficiency tests, and also in the use of using proficiency tests to determine error rates. So here are a couple of articles. I realise when I look at this slide you can't read some of this, but as I said, all of this is available if you ask either Sylvia or myself. I mentioned before, how would you treat a test that you knew was a proficiency test as opposed to a routine case? We don't really know, because in forensic science we don't actually have that data. However, in this paper that I mentioned before, there's some interesting data that they present in relation to drug testing laboratories, where they combined blind and declared proficiency tests at either 24 or 10 laboratories, and found that false negatives were higher in the blind tests compared to when the laboratories knew they were being tested. All right. The 2001 study compared blind and declared proficiency tests in blood lead testing programs at 2 large state laboratories, and found that error rates were higher in the blind tests, and suggested the laboratories were making special efforts when analysing known proficiency samples. So there is definitely a role for blind proficiency testing if it can be set up. And I have some thoughts about how blind tests can be set up, but that's actually outside the scope of this particular presentation, but I'm happy to talk to anybody about it another time. The other thing that I want to talk about is looking at the end-to-end forensic process. So Anya mentioned ISO 21043, the set of ISO forensic science standards which are currently under development. So these standards are, there's 2 standards currently being published, and there are others in process, and unfortunately COVID has slowed that process down. We were going to have a meeting this year to hopefully move the other standards along, but that had to be curtailed. But what I'd like to do is just show you 2 documents. So this document is actually out of ISO 210431, which relates to terminology, and this diagram here is from ISO 210432, which talks about scene recording and examination. And one of the things which was very important in the development of these standards was the fact that forensic science is an end-to-end process. There's a saying in Australia, garbage in, garbage out. If you don't have good collection techniques, good recognition skills at the beginning of the process, sort of for here, review of the scene, and then the actual handling of the control and control of the items. If they get contaminated at this stage, if, as I mentioned, the examination strategy, you don't recognize items or samples of interest, and so therefore don't sample, then you can actually completely miss important aspects of the examination. I've mentioned down here, down at the bottom, I've reminded you of the NATA requirement, or the NATA note I should say. PT samples and items should be handled in the same way as routine casework as far as possible. So the end-to-end process is incredibly important to remember. A lot of the proficiency tests currently available look at the analysis and the interpretation phase. This phase here, analysis, interpretation, sometimes reporting. But this early stage is crucially important. So basically, what I've hoped to show you is that proficiency testing is so much more than just compliance. It's so much more than just ticking the box. Examining proficiency tests and examining your results in a proficiency testing program can provide you with so much information. But don't forget that also a lot of the proficiency test providers also publicly report on the tests that they've actually supplied. And so you can actually benefit by downloading those documents and actually reviewing them. And then you can see what other people around the world are doing. As far as your results are concerned, you can look at things like trends in reproducibility, in reliability. You can use the data in your proficiency tests to determine error rates. You can look at the competency of your staff. Looking at the way other laboratories do things, you can look at method comparison. How do other people actually analyze, examine the same items? You could use that as the basis of some method development, of continuous improvement. You could use the tests for training, to address training issues. One way you can use them is reuse them for training. But the other thing is, if there's an issue that you've identified, you can actually use that for training purposes. You can look at your process flows, your pipelines. How do you actually analyze your work? What does your pipeline look like? What does it look like in other laboratories? There are things you can learn from other laboratories. And don't forget that the process that you need to look at is the end-to-end process, from item submission through to triage, through to analysis, interpretation and reporting. What we're aiming for is results that are accurate and repeatable. We don't really want repeatable, non-accurate results. We don't really want accurate, non-repeatable results, and we definitely don't want not accurate and not repeatable results. I was very interested in Anya's presentation this morning when she was talking about root cause analysis, because I think the way in which we review our proficiency tests, we can learn a lot from looking at root cause analysis. And I was particularly interested in the I've written it down here, Pareto charts, I think she called them, and looking at trends. So over the years, where is it that we actually find that we have issues with proficiency tests? Is it with the item submission? Is it with the triage? Is it with the analysis? Is it in the reporting phase? And then we can actually look at addressing those particular issues. I thought that was quite a useful methodology that she described.